Hey, we'll get underway. Welcome everyone to this, our third webinar in the latest series. Today we're going to be talking about evaluation. Slight change to the billing. We were expecting to have Dan host this one today, but instead you've got me. So for those of you that I don't know and haven't met, I'm Steve Ferris. I'm the marketing manager at Agilysys, and we are joined by Tanya Fostick, who is our director of research. And today's topic is on evaluation. Now, I'm hoping that we're going to have quite a lively discussion about this one. So please do use the chat to ask any questions. If you have any comments about what we talk about today, or if you have any points of discussion or things that you would like for us to talk about, please do pop that in the chat at any point. And we will address that. I hope everybody is fed and watered, because we are going to do a little bit of interaction today as well. We do have some polls for us to go through. So if you're not, just keep one hand free. Now, this is it's a technology I'm very excited by. So it's relatively new. Some of you may have seen it being used already. It's called Mentimeter. So it's a way of interacting with PowerPoint presentations. And also a good example of, I suppose, how you might collect data for evaluation. So that's exactly what we're going to do. So you will see on your screens now, there's a QR code in the bottom left-hand corner. If you scan that with your mobile phone camera, so just open up your phone, open up the camera, hold it over the QR codes, it will pop up with a thing that you can click on that should say, do you want to join, or click here to join. You'll go to Mentimeter, and this is where some of the questions that we're going to ask will pop up. It's completely anonymous, so you don't need to sign in, you don't need to sign up, you just need to go there. Or if you don't have your mobile phones or want to use a browser, if you go to menti.com, and there's a special code across the top and also in the left hand side. Enter that code, which is 68249265. Enter that code and you'll also be able to take part using a web browser, or also on your phone in the same way. Now we're going to keep this code. I think the code comes up on every single slide as well. So if you're not quite quick enough, then you can sign up to it at any point. Five short questions. Is it Tanya?
Yes.
Five short questions, just to get an idea of who's in the room, and sort of some ideas around evaluation so far, and hopefully that'll give us some things to talk about later. So Tanya, should you take it away?
Sure. I'm just seeing that there is a little bit of internal chat that there are people having a little bit of difficulty joining. So I just want to, we're kind of letting people come in still. I'm still letting them in, and I can see we've got 21 who are on Mentimeter. Hopefully there are 31 in the room. So can we, we'll just, I can see it's creeping up. Just give a second or two to get people signed in, because I would like to hear from all of you in that. And fingers crossed, although it's going down now, so people are exiting. Hopefully it's...
Will do. What I will say is that anybody who is having any technical issues, you can just put your answers in the chat, because we will take a look at those as well. I think on one of the questions, there's also an other box, where if you do want to pick that, or if the answer is not quite on there, then just pop it in the chat and we'll add that into the discussion too.
Great. All right, well, I can see that most people are on, and hopefully if you are taking a second or two to get onto your browser, you can join us. So yes, Steve, if we can move on to the first question. Hopefully a really super easy one for you right now. Actually, it'll be very useful for me to understand who's in the room. So which of these areas are you involved in terms of road safety? So please tick as many of those that you're involved in. If you are an other or none of those, just pop into the chat so we can see who else is in the room that I haven't covered with that closed question. I really like this. It's just wonderful to watch it change live as people are answering.
Me too. It's my favourite part of it. It looks good.
Live evaluations. Great. I can see we've got a road safety auditor in the room. Thank you very much. Okay, I think that's probably most people. So, you know, predominantly involved in road safety engineering, but we have got education and training going and comms in there as well, which is all good. Okay, I'm now going to pitch you against each other a little bit. So if we move on to the next question, please, Steve. So, which of these do you think has got the strongest evidence base in road safety? So the way that this works is you can go down the list of these 6 items, and you can assign a number to them. So 1 is the strongest, 6 is where you think we've got the weakest evidence. And what you can do is if you're on your phone, once you've allocated 1 to 6 and you decide that actually you want to move them about, you can just drag and drop them. This one takes a little bit longer than that last question. So fire away, start thinking about how you would rank these in terms of evidence base. Do we know what works and what doesn't work in these different areas? And I think you have to press submit at the end once you've decided on your order. There we go. For those of you who have just joined, we're currently using a tool called Menti. You can go to it through the email address at the top, menti.com, and just use that code. And the question I'm asking right now is getting you to rank these different areas of road safety in terms of what you think has the strongest evidence base. Tricky question, and we are pitting each other against each other, but I think it's just interesting to know where we think we've got evidence. Great, I think that's slowed. And I'm really not surprised by these results here. So engineering and enforcement coming out at the kind of the top 2, closely followed by legislation, and then those at the bottom, the education, training, communications, and that's going to be a lot of what we end up talking about today. Right, shall we move on to the next one, Steve? So this one is over to you in terms of your thoughts really from as an open question. So what this will lead to is a bit of a word cloud, but you've got 3 opportunities here. So you can write 3 different things in, but how do we know what works and what doesn't work? And what we're going to do is leave these answers hidden until we've started to collate them, because we don't want you, prime evaluation technique here. We don't want to influence and skew the answers. So we want you to tell us what how we know what works and what doesn't work. We'll give you a few minutes for this one because it's so you can see we're getting answers. We just don't know what they are yet. Do you want to, let's just give it a couple more seconds.
Well, I really like the animation of this one. It's
I do.
Such a tease, isn't it?
It is. We've definitely got some which are bigger than others. Let's go for it now. And if people, so if you can unhide those.
Okay, going for
and
the reveal.
Even though people are still adding, we still want to know about them. So we've got a range here, but yeah, there are definitely words which are coming out the most strongest. So we've got evidence and evaluation, monitoring, surveys, good old data, which is making me happy. Yeah, but we've also got things in here like experience and being, targets met. What else have we got that's in here? Casualty reduction after studies. So we've got a whole load of methodologies in here, and also kind of ways of, types of data, types of approaches that we might be interested in looking at. So thank you very much for those. And then if we move on to the next one, which is another open question. So what do you think are our biggest barriers to evaluating in road safety specifically? Because it's all well and good having everything that we've said on that last slide about the driving for evidence, but actually, what is stopping us sometimes from being able to do this? So again, you can put in, I think, 3 options here. No answers yet. Yes, that's because we're getting some great thinking going on. Suzanne says she's definitely
Just
submitted
check.
some
Sorry,
answers.
has it stopped? Has it stopped sharing? Because I've got 54 answers I can see.
Oh, I can't see that. I can't see any. Right. Okay, that's fine. I can see a little number next to it, so that's mine. Just says waiting for answers. In which case, press reveal. Let's go for it.
Press reveal. You able to see that?
No.
Oh, okay. It looks like it's not sharing. Okay, I'm going to stop sharing and I'll share the screen again. I think that's a technology failure.
There we go. Thank you. Yep. Funding, time, skills, knowledge, budget. Again, I'm not shocked by any of those. That's the kind of thing I expected to see. But I'd also think, some of those ones about data, incomplete data or lack of data, data gaps. Shouty people. That's if somebody wants to tell me what shouty people and expand on that a little bit more in chat, I'm intrigued by about that one. But yeah, those are, again, we'll come on to those in the discussion in a moment. But yeah, all really useful. And then we've got one last question before we kind of stop grilling you guys and get on to me presenting. So which 2 of these are the most important to you when you're thinking about evaluating road safety interventions? So we've got independence, a robust design, cost, practical findings, a plain language report, and timeliness. From an evaluation perspective, I really like this tool. It's good fun how it works. What's interesting here, though, is the spread is pretty even across them all. But let's get a few more in. Wonderful. I'm really encouraged by these, actually. The fact that we're wanting a robust design, independence is pretty high up there. But actually that whole timeliness and practical findings, so bringing together rigor, which is what we want here, but actually we don't want to wait years and years and years in order to get the results, because we want to be able to apply them. Exactly what we like. Brilliant. Thank you so much for participating in that. I think it will kind of set the scene as we go forward with the presentation. So shall I go ahead, Steve, and start sharing
Please go ahead.
Okay, let me
Just a reminder to everybody, please pop any questions that you have in the chat, or anything that you'd like us to discuss or to raise. Really like some discussion points for later after the presentation as well.
Right. And just before we move on, it was Peter who put shouty people. Yeah, academics who keep on shouting the loudest until they get the pot they want. Very interesting that, yeah, you kind of end up spending a disproportionate amount of money on particular areas not because of evidence, but because, yeah, you've got loud people. Definitely a big barrier. Anyway, right, let's crack on. So we have just explored, we've got lots of challenges then, but really what I'd like to talk through today is why evaluation really is so important, and some of the things that we could potentially do collectively in order to help some of the evidence base, improve some of the evidence base. And I've just got a doorbell ringing there, which I probably shouldn't have. Right. So firstly, we've seen in the polls that the approaches to evaluation in different areas differ. Yeah, they're not the same. If you remember back to that first chart where we looked at where we thought the evidence base was, we looked at engineering and enforcement as having a much stronger evidence base. And if we think about that, you know, the ways in which we work, safe speeds, actually, we do have a lot of evidence about, and it's reasonably straightforward in order to measure the impact of speed-related interventions, whether it's enforcement or speed limit reductions or the use of vehicle-activated signs or speed indicator devices, because we have robust methodologies. We can measure the speeds before the intervention, and then we can measure them afterwards. And we can use control sites, and we also can use different statistical methods to account for potential influences on our findings, such as good old regression to mean, which used to haunt us in the safety camera days of old, when I was involved in that. But it does mean we can use robust data sets, including observed vehicle speeds and collision data, to understand the impact of those interventions. And for the auditors and engineers in the room, you know, you're much more familiar than I am about how that you can measure the impact of safety schemes on the roads. So, you know, there are strong methodologies for monitoring collision rates pre and post. There's standard practice, which allows for comparable studies. But much of what we end up talking about in terms of road safety is that last one, that one about safe road users. And at the bottom of the rating scale, when we were just looking a moment ago, was education, communications, and training. Because actually, when it comes to some of those things about changing behaviour, we don't always know what works and what doesn't work. So some of you may well have seen this report, which was published in 2021, and it was by the GRSF and World Bank. And it was looking at the evidence base related to interventions across the safe system. And so it lists where there is really strong evidence of interventions, you know, in safe roads, safe vehicles, post-collision response, etc., which are seen to be effective, where we've got good evidence. But in places, it's really can be quite scathing about the safe road user element. There are some road user interventions which they show they work, which, you know, they're quite happy to say, hey, we need to be doing these. But actually, there's quite a lot related to training and education where they're really not quite so keen. So this is a quote from the report, and it acknowledges the importance of, say, training children to cross the road, but it still argues that it's uncertain what the safety impact is. And when it looks at school-based driver education, actually they say that it really doesn't help young drivers at all. And also when it comes to kind of knowledge-based interventions, they say that it doesn't necessarily increase safety. So shall we stop doing road safety education altogether? There are an awful lot of negatives in here, but actually, as you can see, it's all about evidence. So, okay. Does it mean that we should stop doing road safety education? Well, yes, if we don't know what the impact might be. If we're not having a positive effect, then we could be wasting public money or doing harm. Or alternatively, we could look at it that perhaps we should be adding to the evidence base. So if we are evaluating our schemes, let's carry on and build that robust data. Because as far as I can see, actually, the question with the GRSF report and the fact that it's scathing about road safety education, it could be that it's, it's that road safety education doesn't and can't work, or it could be that we just don't know if it works. And I think they're really subtle differences. So what I'd like to explore now is kind of some of the reasons why we haven't necessarily got that evidence base and what we can do about it. So a couple of years ago, we did a piece of work for the RAC Foundation, which explored the ways that people evaluate and use behaviour change theories in road safety education. And I just picked out some quotes here about some of the reasons why we don't necessarily evaluate everything that we ought to perhaps do. So these quotes all refer to passion in road safety actually being a weakness, because people don't want to set themselves up to be judged by others. So actually, rather than setting your good idea out there to be assessed, perhaps it's just better to assume it works and not gather that data. And some of these quotes, though, were actually talking about how important it is to hear about things that don't work. So we only tend to hear about the good ones, that people only share things when they get really strong results. And again, maybe we don't hear about them in road safety education. I will come on to this in a moment. It's really difficult to get strong results in road safety education. So maybe that's why it's not out there and being shared all the time. But there are real benefits from evaluating and sharing those results, whatever they might be, because actually, if we're all spending that money and time and resources, it says here, doing things slightly differently without even knowing how it, whether or not it works, that's public money that we're committing here. So let's just roll back a little bit and think about the reasons for evaluating. And I suppose we've touched on some of this when we were doing those word clouds and right at the beginning. But an evaluation really helps you to identify and demonstrate whether or not that intervention has had had or hasn't had an intended effect. So, say we're trying to do an intervention to change people's intentions to use a mobile phone. Are we actually, able to measure those intentions? Are we able to demonstrate that we've had that change? Are we able to demonstrate that an intervention has increased knowledge about speed limits, or about improved confidence when riding a bike? Have intentions to change in a particular way, behave in a way, have they changed? So it really does help us to demonstrate success or not. But it also helps us to provide evidence to funders and policymakers about what we're doing. Policymakers will need to know if these things are affordable and practical, effective and cost effective. Are they acceptable to the target audience? Have they got any negative side effects? Can they be delivered equitably? I read a great piece of research not so long ago produced by Nesta, which included a quote from the economist John Maynard Keynes. And it said in there that there is nothing a government hates more than to be well informed, for it makes the process of arriving at decisions much more complicated and difficult. I think we should be making our policymakers' lives a little bit more difficult, making them make those informed decisions rather than reactive populist ones, like Peter talked about with the shouty people within Birmingham. Thirdly, evaluations can actually tell us how to improve our interventions so that they're delivered well to the right audience in the right place. So the evaluations can examine whether it flows well, that there are no technical hitches, and that deliverers are confident delivering. And by evaluating, we can learn from one another and share what works and what doesn't work. So we're not repeating each other's mistakes. And so it adds to that evidence base, which is where I think the GRSF really needs some help. We can assist others very early in their needs analysis stage of intervention design if we are out there sharing our evaluations. We talked about funding being a barrier to evaluating, but actually a lot of money goes into designing products and implementing interventions. It really is necessary to show that what we're doing with public money works, and also that it was good value for money, because it could be a really highly effective intervention, but it only reaches a small number of people, and that makes the cost per head extremely high. So as many road safety interventions are using public money, is it acceptable to deliver an intervention that costs a great deal per head? Bit of a philosophical question there. I'm not sure I can answer right now, but it's certainly something to consider within our evaluations. But really the important one here is this one. We need to ensure that interventions don't do harm or have unexpected negative consequences. I can't stress this one enough. We wouldn't expect pharmaceutical companies to release medicines onto the market without testing how effective they are and what side effects they might induce. Now, if we think of behaviour change techniques in our interventions as ingredients, these are the active things which allow us to make to instigate behaviour change. We need to know what those active ingredients are so that others can replicate them. We need to know who they work for, and also what the dose or the frequency of delivery might be. And we also need to know if there are any potential unintended consequences, the potential to do harm with those interventions. Because interventions can be designed with the best intentions in mind, and we've got probably lots of examples of those that we can think of right now. But there's always a danger when trying to change human behaviour that it will lead those humans to do something else, which could actually be more risky than the original behaviour. So why don't we have the evidence for road safety education, kind of thinking back to, thinking about those good reasons for doing so? Well, actually, if we compare them to different road safety interventions, the types of data we can collect for educational programs is much more remote from our end game than some of those other interventions. Because obviously, if we reduce a speed limit or carry out some enforcement at a specific location, we can measure the speeds before and afterwards at that location, and also at similar untreated locations. And so if speeds are lower at our treatment sites, we know that behaviour has changed. Similarly, we can engineer a section of road, so we could add a new junction or improve the lining, change the runoffs or install barriers or alter the barriers. We can obviously measure the number of collisions at that location before and after, and compare to similar untreated locations. And if locations are lower, we can make some assumptions about the effectiveness of the scheme. Again, I'm going to kind of put a caveat here about regression to mean, but obviously all of this is much easier to control for. Education is so much more difficult. Now, we can measure the knowledge of the people we educate before and afterwards, but how do we know if that's changed on-road behaviour? And how do we know that that on-road behaviour change actually has links to on-road safety? How are we going to measure that change when it's about tracking people rather than monitoring a specific location or a set of locations? So it does mean that it's demonstrating impact is not so simple when it comes to education, but that doesn't mean we can't do it. So let's explore some of the ways we might think about that. So this diagram describes the types of evaluation we might want to do to add to that overall evidence base we were talking about to inform future intervention design. So to build the evidence base that GRSF is asking for, we probably need to aim as high up this pyramid as we possibly can, because the evaluation data do become more robust the higher up we go. But actually, it doesn't mean that this other range of evaluations types are not valid. We shouldn't be just thinking, oh, we ought to do a randomized controlled trial for everything. That's just not practical or the right thing to be doing, because there are different reasons why we would collect data for all of these different types of approach. Because we definitely need to see the value of qualitative data collected through expert opinion, and actual experience came up as in some of the how do we know what works in the word cloud earlier. case reports where we're getting detailed information through focus groups or interviews or open questions in surveys. It actually helps us to get real insights to understand that quantitative data we may well be collecting. And then moving up the pyramid, we can collect quantitative data with some of those more robust designs, including comparison or control groups, and where data are collected before and after an intervention. Case control studies are less commonly used in road safety evaluations. I'd be interested in if anybody in the chat has taken that approach, because it tends to be used in health where we identify individuals with a particular condition and then compare those with those who don't have it. It can be quite difficult. So, I mean, it'd be the equivalent of identifying motorcyclists who haven't had a collision and comparing them to the characteristics of those who had. There's all sorts of kind of underlying factors which would make it really difficult to kind of pull apart the factors there influencing collision likelihood. Now, randomized controlled trials are not frequently undertaken in road safety, but they're not impossible. I think one of the reasons why we don't use them is because it's that concept of denying a group an intervention. However, if we don't know if it works, it probably isn't a moral dilemma to keep them to one side, and they could always receive the intervention at a random date. Sorry, at a subsequent date, because what they involve is randomly assigning individuals to receive the intervention or to be in a control. So the ride-free evaluation, which we ran a few years ago, it was a RCT because it was a pilot, and we could actually have quite small sample sizes where we could allow, we could randomly allocate participants to one of 4 types of CBT, which is what we were looking at. Similarly, Driver 2020, which we've been waiting for a little while and hopefully is on the horizon, that's an RCT. And they were able to do that because it's a national scale, large sample sizes, and tracking individuals over a period of time. And obviously, evaluations could be mixed methods, so we can collect both qualitative and quantitative data from different methods in the pyramid. So when starting to build an evaluation design, we need to think about what we want to learn. So the first question we really need to ask is, well, is it a process or an outcome evaluation, or it could be both? So a process evaluation is about improving the intervention delivery, and an outcome evaluation is to show the effectiveness of the intervention. So you can see why there are good reasons why you would want to do both. That process evaluation is not about understanding if somebody enjoyed a session or how many people attended. It's about the delivery. So we want to know, it's not kind of happy sheets of did they like the sandwiches, but actually, are there elements of it that we could make sure that we've got the right people turning up? Are there different ways that we could communicate with participants so that they get to the right place at the right time? Does the content work as planned? Is there a need for training to ensure that those who are delivering are confident with the materials and the technologies? One way of doing a process evaluation could involve mystery shopping an intervention to observe the way it's delivered. Or we could interview presenters to get their views on the flow of content. It could ask participants about the booking process or the length of the session. And also, if it's a pilot, we could see, how it might be possible to run things on a larger scale. So it's important to find out if there are barriers or opportunities that would come from wider rollout. There are things here about kind of incentivization and recruitment. All of these different things kind of have to be explored and can be done so in a process evaluation. Whereas outcome evaluations are where we are assessing the effectiveness. So this is where we measure against aims and objectives, and I'll come back onto those in a moment. So this is where it's really important to think about the methodologies we're using and not just taking results at face value. We could still be doing harm here. One example I have of this is that we were involved in a pre-driver intervention, and we were finding that we were getting really positive results in terms of knowledge. But actually what we then did was we ended up kind of exploring through focus groups at the beginning of the day, just to kind of gather some insight data about how people were thinking and feeling. And what we found were these groups of young people were coming with really quite positive attitudes and really quite good positive high levels of knowledge. They then had a whole day of quite hard hitting in places content. And we held some more focus group type sessions at the end of the day. And within those sessions, what we found was that they were actually kind of normalizing some of the behaviors that they'd heard about all day. So, for example, mobile phone use, right at the beginning of the day, they were actually, well, I'd never do that. And then they'd had presentations which said, but you're young and young people are more likely to use their phone, and young people are more likely to be in crashes using their phone. And therefore what we got was them kind of almost excusing it. Well, you've told me this is what I do. I'm one of this target audience. It's almost inevitable that I'll be behaving in this way. So when we'd done the quantitative data, actually we'd looked at it and we'd got quite positive results in terms of knowledge and attitude. When we dug deeper down into it, we got a really different picture. So I think it's very much about making sure we explore those results, and as I say, don't take them at face value. So just kind of touch a little bit more on some of those different evaluation designs. So yeah, I've already talked about randomized controlled trials. So we've got those who are allocated randomly to either receiving the intervention or not. So that's where we have what's known as an intervention and control group. And actually, they should be pretty similar because it's just chance whether or not they were in one group or the other. Comparison designs are slightly different. So this is where one group has the intervention and one doesn't. And we want to make sure that they're as similar as possible. We often do this with school-based education. So you could have the schools who are participating and then a comparison school of those who are not. We would hope we would collect data to try and to see how similar they are across. However, that doesn't mean that there aren't some ways in which the two groups may differ. For example, the schools, there could be a reason why that school isn't participating. It could be multiple different reasons. But what we do is understand, kind of measure before and after and then compare with that comparison. And then you can do a good old before and after, which is, for example, doing a survey the week before an intervention, then sometime afterwards. The problem of doing that without having a comparison or a control group is that if something has changed in that period, and it could even be asking the questions twice, it could be that your measurements change. It isn't because of the intervention, but because of something external, or because, I say, of asking the questions twice. And if we don't have a comparison group that would be subject to the same external influences or asking the question twice, we don't know whether or not that effect is there. So that's certainly something to think about. And then the last thing really to think about here is kind of our methodology. So do we want large samples of closed data where we can directly measure change? Or are we interested in gaining those detailed insights I've just spoken about into what people think? We could and perhaps should take a mixed methods approach. So we could look at the overall averages and the percentages of kind of those closed data, and then delve deeper into finding out why those positive or negative changes occurred, or what key messages they recall, or what their thoughts were on the intervention, or what they could do differently as a consequence of it. So focus group discussions and interviews allow us to pull those things apart a little bit more. And I think what we have to do is actually be quite flexible in our approach. So these are three different approaches we've taken. I just want to kind of talk through why we took the approaches we did. So Ride Free was a randomized control trial. The reason we could do this was because it was those small numbers. It was a pilot, and firstly we wanted to test 4 different versions of CBT. And we wanted to kind of give everybody a fair chance at being in one of those 4 groups. It wasn't self-selecting. It was an incentivized program where we were paying for young people CBT, and as such, they knew they were being allocated to one of 4 groups. It was a real opportunity. If it was a much larger intervention, it would be much more difficult to do it in that way. When we've done things like the Safe Drive Stay Alive evaluations, then that's where we've used comparison groups, and they tend to be pre and post interventions, and the comparison groups are the schools, as I've just said, who don't attend. And then something like Bike Safe, which is really difficult to get a control or comparison group because they're self-selecting. How do you compare motorcyclists who don't attend Bike Safe with those who do? So the approach we took there was really longitudinal. So we looked at behavior, knowledge, attitudes over a long period of time with a very large sample. So then we could understand the effects a bit better. Okay, so where on earth do we start with all of this? Because actually, how do you know what methodologies you want to be using? One of the good places to start is probably by setting your clear aims and objectives. They help you with designing your intervention and also with designing your evaluation. We often come across people who would like to evaluate their intervention after running it for many years. And the first question we ask is, well, what are your aims and objectives? And more often than not, people haven't got defined aims and objectives. There is one plea from today, actually, that I can go away and think about, is explore the aims and objectives you have for your interventions and think about reviewing them and making sure they're there and they're robust and people all understand what they are. Because they can really act as a plumb line in your designing of your intervention, but also helping to shape your evaluation questions. So throughout, how do these things relate to my aims and objectives? If I'm asking this question or developing this content, what does it mean in relation to that aims and objectives? Objectives need to be measurable. So these will inform what data you will collect, how and when. So kind of coming back to the complexities of demonstrating impact of road safety education, this is where we need to be clear about what we're trying to achieve. So are our objectives to increase knowledge or improve attitudes or change behaviour? How are we going to measure any of those, and how are we going to link it back to the intervention? Logic models are a really useful way of helping to formalise these. So these are a really good exercise where you list all of your inputs, which are the things that you need in order to deliver your intervention. Your outputs are your intervention, the way that you're delivering whatever it is you've chosen to do. And then you can create your aims objectives and start to think about how those inputs and outputs will lead to your desired outcomes. Outcomes are kind of the stages to your objectives. And at this point, you may find you need to refine your aims and objectives. You may find you absolutely completely need to redesign your intervention because actually what you assumed might lead to your desired outcomes, it isn't going to get you there. And this is where assumptions and external factors really come in, because they help you to think about what might affect the flow of your intervention or your data collection of your evaluation. So you can identify these and really factor in for them. So are there things which will stop this flow working, these external factors? Am I making assumptions that I need to measure and test as part of my evaluation? Logic models I found in the past are really good to talk through with colleagues, because you can kind of challenge one another on how step one is going to lead to step two to step three. It should be a process. This is just a Scottish Government example, but the idea is it's a flow. So however you think to draw your logic models, just think of it as a process. One resource I would really point you to is Evaluate. And I think I saw in the chat, I haven't been monitoring it properly, but I did see about kind of where do we go to get some help. This is a really good place to go. It's a useful resource for helping you to plan your evaluations, thinking about kind of what questions you ought to ask yourself when you are pulling together your evaluation design and your intervention design. So who's going to benefit? What's the issue? What evidence have you got that there's a problem in the first place? And actually, if you can't answer some of those questions, perhaps it's you should go back to the drawing board. I think when I've used Evaluate way back in the past, when I was kind of on the practitioner side, actually by just almost going through the process, it allows you to pause and perhaps not take things a little bit further until you've gone and looked at more data and evidence. So it really is very useful. But what it does is once you've gone through the process, is kind of spits out some recommendations on evaluation design and tells you which are the strongest and where you're likely to have more robust results. So it's definitely a really useful place to go. And it's also got a very useful glossary and some also case studies of other road safety evaluations. So I would very much recommend you go there. So I just want to kind of touch on some other considerations in terms of evaluation design. So think about the methods you're using. A wordy questionnaire is not going to be suitable for young children or those whose language is not the language it's written in is not the first language. Having internet only surveys could prevent the deprived or elderly, for example, from participating. There can be a skill to writing questions and topic guides. One of the things that I got a big bugbear about is people asking too many things at a question, in one question. Having "and" in a question is really difficult, because what if somebody agrees to the first part and not the second part of the, did you like the sandwiches and was the setting nice? If they say yes, are they saying yes to both, or did they just like the sandwiches or the setting? We can't pull that apart. So we also don't want to be too leading in our questions. Timing is super important, because we might really need to get immediate feedback from participants, because we're never going to see them again. Our access to them is limited. But we also may want them to have some time to think about the intervention, and we want to measure long-term change, long-term knowledge gain. Does the attitudinal change occur, still exist a year later? Incentivization is something to think about to encourage participation. But again, it needs to be suitable for the audience, and we do need to think about kind of the ethics of that. Are we incentivizing groups or giving away something that's disproportionate and could be seen as causing more problems? So it could be an entry into a prize draw or a voucher on completion, which does tend to cause less money than giving cash, for example. And then there are some other ethical issues to consider, such as working with children or vulnerable people. Evaluate does give some advice on that. Okay, so I kind of got, starting to wrap up a little bit, and I will come to questions in a moment. But I think there's kind of some what ifs, and we've probably touched on some of these a little bit right at the beginning. So what if the evaluation shows it doesn't work? Okay, that's still a result. That's still a good thing for that evidence base with the, what the GRSF is wanting here. Lots of people are nervous about evaluating in case they don't get the results they want. Yes, it's disappointing, but actually, surely it's better to know this. We can then better allocate funding, or we can redesign. And so it really does help us to learn from what works, and make sure others are not repeating same mistakes. So we really shouldn't be embarrassed to share results. Sharing good and bad results are both of benefit. Funding came up earlier. What if we haven't got the budget? Well, it doesn't have to be expensive. There are lots of different tools out there which can allow us to distribute surveys and interventions in different ways. We don't always have to include a comparison group, and there are different techniques in which we can kind of only capture data at one point rather than a before and after study. But the rule of thumb should be that about 10% of an intervention should be spent on evaluation, because coming back to that initial question of doing no harm, should we be doing this thing at all, spending public money, if we don't know whether or not it works? And time and expertise, again, this came up in the word cloud. Well, actually, you can always approach external evaluators. So they do have the skills and expertise. They can point you in the right direction, or they can undertake the whole evaluation for you. So I just wanted to kind of finish up on some of the fact that actually that evidence base that GRSF were talking about, it is changing all of the time. We've got that great work that Liz Box has recently been doing on the theatre and education approach to pre-driver education. we should hopefully get Driver 2020 results soon. This is a huge study. The methodology was robust. It really will help us to understand what works and what doesn't work for young drivers. And I also wanted to do a little bit of a plug for the Road Safety Trust, because I am a trustee. And it does fund projects which include evidence reviews, trials, rollouts, evaluations, and guidance and support resources. And I just wanted to there is a wide range, and I think I just saw James talked about the Knowledge Centre. These will all be on the Knowledge Centre. And there's just a wide range of different evaluations and studies out there. So we can learn from these different evaluations and groups, but what I would really like to do is actually for all of you to consider applying for Road Safety Trust grants, getting involved so that we can all learn from the findings and keep adding to that evidence base. And on that note, and I can see we've only got 9 minutes left, let's see what the questions are.
That's great. Thank you, Tanya. I've actually got a couple of questions as well. If anybody has any questions, comments, please put them in the chat and we'll address them. I want to pick up something on that Sam has said in the chat, talking about from a safe system perspective. Now, in the past 10 years or so, road safety education evaluation, it seems to have moved on massively from what I remember at the very beginning. But what about this next step? How much further do you think it needs to go to really start thinking about filling the hole for safe road users when it comes to the safe system?
I think what's been disappointing in the past, and this came out in the RAC Foundation work, is that actually road safety education is seen as a bit of a poor relation, or it's felt by those who, by some of those involved, that it hasn't got the same standards and evidence base, even qualifications as perhaps those in engineering, and enforcement comes with a whole load of legal requirements of how you act and how you deliver enforcement. So I think actually education is a fundamental part of the safe system. It's one of the key operators. Perhaps we do need a framework and evaluation standards so that we can actually say, no, these are the things that work and we're very confident in them. And we're all evaluating to the same standards. And we are on a par with those in engineering and enforcement.
Well, on the subject of the sorry, I get my acronyms mixed up. GRSF
Yes.
report. It's talking about education. Do you think that's more poor design, poor intervention design, poor evaluation, or is it the same thing?
So I think it's a combination. I think in the past we've had a lot to learn about road safety education and what works and what doesn't work. And I think it's all related to all of those things I said early on. It's more difficult to evaluate education because we're so far removed from in the classroom from the behaviour 2 or 3 years later on the roads. How on earth do you track that? How do you track individuals so we know what the impact is? We're asking for the impossible there. So I think it's a little bit of a evidence void. But I do think actually, whilst we've had well-meaning interventions delivered in the past, they haven't been evidence-based interventions. I do think we're much better at that now.
And of course, like Driver 2020 is one of the ones which really links the behavioural aspect with an outcome, because it's looking at sort of post-test collision involvement.
Exactly. It's, as far as I know, Driver 2020 is the only study of its kind worldwide which has tracked pre-drivers and new drivers on the road for a period after the intervention. Whatever the findings, this is going to be groundbreaking.
Really looking forward to that one.
Definitely.
One of the other things that also came up in the little Mentimeter that we did earlier today was talking about barriers. So I was having a look at some of the other answers. A lot of it talking about data and control over data, or what kind of data to measure. Obviously very important when it comes to evaluation. And Amy's just asked the question, what's the best way to measure a campaign's impact on behaviour change? What sort of measures can you put in place to when looking at evaluating education?
Sure. Well, I think the first thing is to answer Amy's second question is, can you ever actually link casualty reduction to an intervention? Very, very difficult, unless you're tracking individuals over a very long period of time, because actually very few of us do crash. And therefore the numbers involved in, the sample to actually be able to say that this has reduced the likelihood of a collision, it needs to be vast, which is why Driver 2020 is of the samples size as it is. So we have to use proxy measures. But that then makes it, every time we're using a proxy, we're getting further and further away from our ultimate aim of casualty reduction. So obviously attitudes are much more difficult. They're not as robust as, say, actual behavior. So if we can monitor on-road behavior in some way, again, that can become expensive or complicated to do. You're tracking individuals. Because again, like the speed or the road design, you can't stand at the side of the road and track mobile phone use unless you know who's had your educational campaign, because every single driver who's gone past there, how do you know which one's been exposed to your intervention? So it does get a lot more complicated. It's thinking about your proxy measures, knowledge, attitude, intentions, and how they can directly relate to our overall aim of casualty reduction.
Last thought then in that case, when it comes to guidance. So a question that's come from Sam talking about either some sort of national framework around evaluation or the roles that regional or national forums can have in pooling resources. What sort of perspective can you give on that?
So we've got James here, and RSGB is a great resource there in terms of putting the reports up from places like Road Safety Trust. I think, again, with my trustee hat on, the rigor that goes in reviewing those reports and approving the grants in the first place means that they do have strong methodologies. These all go onto the Knowledge Centre and therefore accessible. So we don't need to reinvent the wheel. What I would really like is more people to be using the findings from those in their everyday practice. Going back to my earlier thing, I think an evaluation framework that is consistent across the country, some real strong guidance for people to evaluate in the same way. However, there are good resources out there. Fiona Filan's guide to using behaviour change techniques has an entire section on evaluation, because actually those go hand in hand. If we're going to be using behaviour change techniques to design an educational intervention, we also need to know we need to know how we're going to evaluate it, and what our aims and objectives are. Intervention design and evaluation design sit hand in hand. We should always be doing the two together.
Fantastic. Great final thought. Thank you very much, Tanya. Thank you, everybody, for joining us. Just a last reminder that we have recorded this. It will be available via our website. We also have another webinar, the final one in the series, coming up next Thursday. If you'd like to register for that one, also you can do so through the page I've just popped in the chat now. We will be talking about rural roads, so further updates on the Rural Roads project about classification or finer point classification of different types of rural roads. Thank you again, and hope to see you soon.
Thank you all.